Orthopedic surgeons are working to highlight the growing need for early detection and awareness of scoliosis. In this morning's Wake Up Wellness, Dr. Cheryl Lawing with Advent Health Tampa explains how it's monitored and treated. An abnormal curvature of the spine, or scoliosis, often occurs in kids ages 10 to 15 years old.
It does tend to run in families. So if you have a first degree relative who has it, your risk goes up. It's thought to be around 10 or 11%. That being said, the majority of the scoliosis we see is just completely out of the blue. It has something to do with growth. We call it idiopathic, meaning we don't exactly know what causes it.
Here in the state of Florida, school nurses screen middle school students for scoliosis, but it can develop in infancy or early childhood. So parents should discuss it with doctors during annual checkups.
Anytime a child goes to see the pediatrician, they really should have their back looked at.
Otherwise, scoliosis can progress without pain and go undetected.
Normally a silent disease where most children who have scoliosis actually don't have pain. And it's not until you have a really extreme curve where you're going to notice anything like shortness of breath. The most easy way to tell is just look at things like the height of the shoulders, the waist on one side compared to the other.
Dr. Lawing says most cases are mild and can simply be monitored.
Most curves actually we can just watch or treat with non-surgical means.
More moderate to severe cases can require the use of a back brace or even surgery. Well, there are no prevention methods. That's something you want to be aware of. So that's why you want to keep a close eye on it as your kids develop. And you said you've even experienced it in your own family.
Yeah. And this is all the more, I'm so glad you did this, all the more reason to discuss family history with family members, because you don't know what you don't know.
Yeah, good to keep an eye out.